right, so coming at you sort of from the, I don't want to say front lines of the corona crisis, because I am nowhere near the amount of stuff that Italy is dealing with, or New York City is dealing with, or Seattle is dealing with. Luckily, our very limited patient population in the Las Vegas, Nevada area has been handling the situation pretty well. Everything has been, it's in process. Again, we are still, just like everywhere else, we are still very low on PPE. It's being regulated on who can get it, who can't get it, how much you can reuse your mask, how many times you can reuse your disposable gowns, and everything like that. So I'm definitely feeling the impact of that and feeling it pretty hard. So I think right now, so I know that this will happen today. It's all finally, like it's hitting me. It's real. And I had that realization yesterday for the first time when I went to see a patient who was in the emergency department, and the ER doc gave me enough of a sign out, but didn't really emphasize sort of how sick the person was. And so I went in sort of just basic surgical mask, and I've made it a practice now to wear gloves for anybody who's in the hospital, just for my safety and for their safety. Then I cover my stethoscope with a glove also to prevent any kind of, I guess, cross-contamination with the people that I'm taking care of. So I went into the hospital, I went to the ER bay to see the person, and surgical masks and gloves, and they did not look like they were going to do very well at all. And in my head, I was like, the patient doesn't really look like COVID, doesn't really sound like COVID when I got my sign up from the ER, more of an abdominal GI complaint. But then you go back and you look at the chart a little deeper, and I started seeing things that were like, infiltrates on the chest x-ray, fever, high fever, cough, sputum production, things like that. So I found myself going back and reading up to date and finding, trying to convince myself that this patient did not have COVID. And it was probably the most terrified that I've been so far in dealing with this. For about 2 weeks now, I've been on consistently during the crisis that has been sweeping the US. Really, today was another big day for it. I have personally, I think 9 people that are, no one's presumed positive and nobody is positive that I'm dealing with. But I'm getting a lot of rule outs just because the patients that I take care of, everyone's over the age of 65, everybody is in the hospital, they're all sick with multiple comorbidities, and they're the people that we're scared for. So it's very important that these people get taken care of and we make sure that they are not at risk for themselves or anyone else, especially spouses, family members, things like that. All very, very real. Another, we're starting to see the shortage of everything. Our masks are on lockdown. You have to get approval to get one, to get an N95 respirator, or even a surgical mask with eye protection. And I had a very troubling incident today with that, trying to get to a patient who was not doing well, got a rapid response called, and I couldn't get into the room for 10 minutes because we were waiting for a respirator. Luckily, the nursing staff was all equipped and they were in there taking care of it to the best they could, communicate with me through the door. But until you're in there, for someone you've grown to care for, that you're taking care of and trying to get better, for that to be a thing, it was just devastating. So what are we seeing? Where are we at? And again, I'm offering before I say anything, I'm not an infectious disease doctor, I'm not a specialist, I'm not at the forefront of everything. So what are we seeing? We're seeing a lot of, at least in Nevada, we're seeing a lot of rule out cases in our hospitals. I haven't seen very many presumed positives or actual positives. I have none on my census, which is, thank God, for me, but it's still not any more reassuring going into it. Everyone's getting very tired. I think the nursing staff is a bit overextended. We're starting to shut down wings of the hospital to save for mass admissions or to save for if we need it. I think as a whole, the hospital admissions are down in general. We have a whole wing of the hospital we're just not using because we don't have the people to fill it, and we're saving it for the people that are going to come in that are going to be critical. As you can see, I'm in a completely abandoned hospital room in the wing of the hospital that we're not using right now because we just either saving it or we just don't have the people to fill it. We've put a ban on all visitors unless you're in the pediatric wing, end of life care or something like that. No visitors are allowed in the hospital. So, we're trying to just take care of people without anyone around. People are scared, people are sad, people are worried. It's the panic of it is starting to set in, but for me, not like super crazy. I'm trying to maintain an objective outlook on this. I'm trying to treat everybody individually and trying to maintain composure myself. Like I said earlier, when I had that one patient who I, wasn't really warned enough of that could have been COVID, that's still getting ruled out. I remember after sitting back and thinking about it and trying to convince myself that the patient wasn't going to be positive, I remember that instant fear setting in. Like, what did I touch? I had my gloves on, but what if I touched something and I wasn't aware of it? What if I bumped into the patient's bed with the side of my clothes and then I touched it? What if my stethoscope touched the patient and then touched my shirt? And you start descending into these risks of fear and these not 100% ever. I don't know. It became very real yesterday and today with the amount of people that I'm seeing that are rule outs, with the severity of the illness in these older people, when you feel like you may have been exposed to somebody who was, and then when you really can't take care of somebody because you don't have a respirator or even a mask, anything. Nothing was available for me to get into that room and to help out. And it was just, I felt like panicky. If the patient was just, if it was like a fake rapid response or if they were doing okay, fine. But like the patient was literally not doing well and I had to get in there and I couldn't. And I pray to God for my nursing staff, and I thank them endlessly for being able to handle that. But it still weighs on you. It also weighs on you when like you may have had some kind of exposure to it and you're like, and you look for reasons to convince yourself that you haven't been. And after reviewing the case side by side with the ID doctor for 20 minutes afterwards, he said it's not going to be COVID. He's like, this is not what we're seeing. This is not the symptoms. This is not what we see on the CT scan. We went over that, the X-ray, the lab testing, and everything else. He's like, this is going to be fine. That was very reassuring, but the initial panic is just insane. And it's insane to sit in an abandoned hospital wing trying to paperwork and chart on 9 people that you're worried are having some kind of life-threatening illness, all of which have COPD, heart failure, hypertension, and diabetes. So my panel is, if they get sick, they're the ones we're going to be worried about. So just trying to get through every day, just trying to get through one day at a time, keep people alive, keep myself safe, keep my family safe, keep my, making sure everybody's just doing what they can. And I think they are. I genuinely think we're handling this very well in Las Vegas as a city as a whole. I'm very proud of how we've stepped up, how we've isolated, whether or not you agree with the governor's 30-day ban on any kind of non-essential business. I completely support it. Just get it out of the way, people. Go home, stay home, sit home, do nothing for 2 to 3 weeks. Just like, let's stop spreading it. And it's terrifying, and it's fun. It's really fun to be in the front lines of all of this, and I'm having a good time taking care of people, learning day by day, reading up on something every day. They keep your knowledge up, being out there with the ID doctors, helping them out where you can, seeing what they think, thinking who can help doing what. It's fun, but it's terrifying. The moment you walk into a room and you're like, this patient could have it, then the panic sets in. So anyway, that's like a brief little update on that. I don't know what to think. I don't know if we're on the mend. I don't know if we're on the verge of an outbreak. I feel horrible for New York, Seattle, and these other big cities that just have no way to handle it. I think because we're lucky in Las Vegas that it's a tourist place, we're not super populated, but at the same time, people are really adhering to this isolation warning, and they're doing very well with it. The schools are shut down, the businesses are shut down. All of the parks and playgrounds by my house have caution tape around the swings and the jungle gyms, and there's no kids anywhere. People aren't out like disobeying orders. We're taking it pretty seriously, and I think that's why I feel we're doing pretty well as a state, as an area, as Clark County, especially because as big as it is, all the people we cover. So anyway, I guess, so that's what we're at in the trenches of the COVID crisis, trying to rule out, for me necessarily. Haven't really had any positives, haven't been exposed, so I don't know that part of it, but just we're beginning the workup and we're beginning to see it explode. I went from one rule out case maybe two weeks ago, and I got 9 on my census now that are rule out. So we're scared, we're dealing with it the best we can. I think that's all we can do. So please stay home, please stay quarantined if you can, please enjoy your family, keep them safe, make that your first priority. Literally everything else can wait at this point. So please like this video if it was anything, I don't know. I'm just trying to document as I go through this. Subscribe. I'm going to try and do more COVID daily update. I don't want to say daily updates. I'm going to try and do more COVID updates as I go through it, as I see more people, as we see how we're as a healthcare system managing it. I've stopped wearing dress clothes. I'm wearing scrubs and a white coat, which I'm going to leave in the hospital. Not the scrub part. The white coat's going to stay in the hospital. I have to strip in the garage. I take all my clothes off the moment I get home. I run right to the shower. Wash your face every day. Don't touch your face every day. Wash your hands frequently. Don't touch your face. Just be smart. And if you have any questions below about anything that I can answer, I'm not going to answer any scientific information or symptom control because I don't know enough. We don't know enough yet, and we're working on it. So please be patient with your doctors. Please be nice to your nurses, and please just respect the people that are just trying to get you guys through this. So until next time, thank you. Please like and subscribe. I'll see what I can do next. I'll see if anything changes, and when we move forward with this, we'll keep going.